Welcome back to Urban Outlook. We are talking about the disparities that exist between African American women and other women when it comes to breast exams and cervical cancer screenings, and the fact that we had seen a drastic decrease in the number of women getting those screenings, particularly during the pandemic. Dr. Bernadette Meadors, a physician of obstetrics and gynecology at the Heritage Women's Center, is our guest today. And before we took a break for commercial, Dr. Meadors, you had talked about the disparities exist. And I know one of the other things that has often been a topic of conversation whenever we've talked about women and their health has to do with the affordability of medical care and the fact that sometimes it's trying to find the funds to go to the doctor and get the exams that you need to get. Can you talk just a little bit about that disparity and where women, especially Black women, fall when it comes to the affordability of health care?
Yes, that's a very good point. You know, and the Affordable Care Act was great because it mandates, for the most part, that preventative care such as well-woman exams are fully covered if a person has medical insurance. But not everyone has medical insurance. And with the COVID-19 pandemic, not only were we worried about women that had previously been uninsured or underinsured, we have people that have lost their jobs during the pandemic, and that comes with loss of insurance benefits. And other factors that lead to people not being able to come to the doctors are now staying at home to take care of children. They no longer have childcare or transportation. So it's been impacted in so many different ways. I will say that the CDC's National Breast and Cervical Cancer Early Detection Program does offer cervical cancer screening and breast cancer screening for women that may not have insurance or that may be underinsured. And if you go to their website, that there are locations in each of the 50 states that we can find that have screening that is available. Also, the Planned Parenthood will also offer low cost or no cost for breast cancer screening and cervical cancer screening as well.
That's great information about the free opportunities that are there to get these screenings, because the longer women delay, the sicker they get, right? When they delay that time, the level and the stages of the cancer, if cancer exists, seem to be much higher, and also the ability to heal or recover or find a cure for what ails them is more difficult from a physician's perspective, I would think.
Absolutely, absolutely. And, you know, and when we talk about, for example, hospitals and offices that were modifying care during this pandemic time, especially during those first 3 months of the pandemic, then women that even already had breast cancer diagnoses, their care could have even been modified or decreased or delayed chemotherapy treatments or surgical treatments, because not only were offices recommended by the U.S. Surgeon General not to do non-urgent care, so was hospitals. So our operating rooms were impacted. And so it's a fine line between what was considered to be urgent and non-emergent, but that really impacted women's care. But delay in screening increases the risk of diagnosing breast cancer or cervical cancer at a later stage, which then makes treatment harder and increases the risk of mortality. Absolutely.
Are there, Dr. Meadors, some things that women should be on the lookout for, some signs that would tell them, you know, even if you want to delay, but things that may be happening? I always say trust your body, right? But things that they may be on the lookout for that should tell them, you know what, you need to get to a doctor right away.
Mm-hmm. Well, when we talk about breast cancer, I think we've definitely touched on that, doing self-breast examinations. And so that of feeling, you know, when we always teach breast exams, patients will often say to me, well, everything in there kind of feels lumpy. And it's like, well, that may be so. But once we've done a clinical exam and reassured you that this is a baseline for you, this is what your breasts normally feel like. When then you do at home exams, then when you feel something that feels out of that range, then that's important to take note of. You know, one of the myths is that breast cancer may hurt. And unfortunately, it usually doesn't. So, and one of the things that we always say is that as far as the breast, bad things don't hurt. So feeling a palpable lump is important and should not be ignored. Cervical cancer, on the other hand, is a little bit more difficult. There are not really many signs or symptoms. And so either further makes the importance of cervical cancer screening important. So usually once there are symptoms related to cervical cancer, they tend to be late. And so that may be a foul smelling, vaginal discharge or unusual vaginal bleeding. But those are important signs to keep in mind.
And how important is it to sort of know your family history and the impact of that family history on what might happen or might be going on with you?
So, if you have a family history of breast, ovarian, uterine, or colon cancer, then that might absolutely increase your risk of cancer, especially if that is in a first-degree relative. That first-degree relative meaning a mother, a sister, or a child. It can also be important if there are more than second-degree relatives, such as grandparents or aunts and uncles. And one of the ones that we don't often think of, but anybody that has a family history of male breast cancer is very important. That significantly increases the risk. Cervical cancer, family history is not quite as important because it's very rare to have a genetic form of cervical cancer. Not impossible, but rare. But most cervical cancer is a result of the human papillomavirus as being the main causative agent of cervical cancer. But cervical cancer is, I should say, the HPV virus is very common, but cervical cancer is honestly less common. So not everybody that has the HPV virus will have cervical cancer. And at this moment, there is some research being done, though, to look at if family history at all relates to an increased risk of being impacted by the human papillomavirus.
Not that I want to get into the whole vaccine debate here, but there is an HPV vaccine for children, even to protect them, correct, from some of the future problems or the potential of future problems.
Yes, and that is recommended for young women and men starting at the ages of 9 to 26 years old. And I think more recent information has shown that we may even give that vaccination to women older than 26 if we feel like the benefits definitely outweigh the risk.
And I guess as we wrap things up, the country is opening back up again. Are you finding that people are feeling a little more comfortable returning to their routine, at least the yearly exams that they need to get?
I do. I feel that in our office that people are coming back and are getting their exams. And I think one of the things that we were initially faced with was having canceled so many exams early on and keeping such a full schedule that going in and getting people back in for these exams are really important. So just really want to encourage people to call and schedule an appointment as soon as possible, because the impact of that has really pushed getting an early appointment out to being a few months. And I think some other places, when we talk about getting, as far as the National Breast and Cervical Cancer Early Detection Program and the sites which offer care for uninsured or underinsured patients, that their impact has probably even been a larger hit, because especially when we look at kind of the health departments, a lot of personnel that maybe were providing screening exams had to be removed from that department and go out and do COVID-19 screening. And so their impact is maybe even huger than in the private sector. And so it's just very important across the board that we really encourage patients to come back in, know that we're using safety protocols, and know that your health comes first.
Dr. Meadors, in our last few seconds, do you want to give sort of a website or a way that if people are interested in the services provided there at Heritage Women's Center, they can get in touch with you or the center?
Absolutely, absolutely. You can always go to Heritage Women's Center or Heritage Medical Associates. We have offices located at 1622 Westgate Circle and downtown at 222 22nd Avenue. And we would be happy to assist you with any of your gynecological needs.
Thank you so much, Dr. Meadors. We appreciate you, and thank you for joining us. We will see you again next time.